Hi, this is Dr. Joanna Penn, and this sequence is for sacroiliac health. The sacroiliac joint is located between the hip bone and the lowest bone on the spine called the sacrum. It's a triangular bone. Women oftentimes get a little dysfunction here, as do men, but women are more prone because we as women don't have as many ligaments in that area to help support the joint. I'd like to start this series with a little education on what not to do. So if you're having some pain in this area here and here, maybe it wraps around to the front, might go down to the knee or travel up to the mid-back, there may be the possibility of a sacroiliac dysfunction. If that's the case, you want to avoid rounding forward a lot. You want to avoid rolling down through the spine, like you're not going to be doing a lot of Pilates roll-ups or hundreds and whatnot. You want to avoid picking things up like this with your back rounded. Basically, avoid those for a while. I'm not saying that you can't go back to them at some point, but right now when there's inflammation, you don't want to irritate the joint. What you do want to do is keep your back slightly arched through the low back. And when you go down to a laying down position, squeeze your knees together, roll over onto your side, and then lay down and reverse that to come up. Squeeze the knees together, roll over onto your side, and push up, knees together to stand. When you bend over, bend at the hips, not in the spine. Okay, so the sacroiliac joint is a complex one. And I'd just like you to follow these exercises knowing that some of them are to release some structures that are habitually tight from an SI joint perspective, and also others are for stabilizing the joint. With no further ado, grab your yoga strap. You can also use a belt or like a robe belt of sorts. Lay down on your bed, on the ground, yoga mat, whatever works for you. You'll take the strap and place it around the balls of the leg or the side of the SI joint that's bothering you. You're going to have the leg point directly up towards the ceiling or a little closer to the ground, depending on your hamstring length. You do not want to bring it in further because that causes the low back to round. So I'll keep it at 90 degrees off the ground. If you're feeling good about that, you can straighten the bottom leg and keep that leg active with the toes flexed up towards the ceiling. Very important here to keep a little arch in the low back. Again, to reiterate, this keeps the SI joint stable while you're stretching. Big inhale, long, slow exhale. You might feel burning behind the knee and the calf. This is okay so long as it's not sharp. This means the connective tissue is unwinding, and that's perfectly normal and healthy. After holding this for 10 to 30 seconds, you're going to take the outside strap, cross it around the outside of the calf into the opposite hand. Then you'll take the leg and cross it over the center line and hold here. This is the most important, in my humble opinion, of the hamstring stretches because it gets the outer hamstring, which connects right into the sacrum via these slips of the biceps femoris muscle. And then outside the frame of the body, keeping the opposite hip down. I like to place my hand on the opposite hip. And finally, remove the strap. Anchor your sacrum, little arch in the low back, and go into a flexed foot, figure 4 stretch. You can hold both hands here, or you can remove one hand, place it on the top of the femur, press away from your face and up towards the ceiling. This is a great traction for the hip joint, and it offloads the external rotators, which attach into the sacrum. So this too is a really great exercise for releasing some of the spastic structures involved in a sacroiliac joint dysfunction. Okay, moving on. Take a pillow, a ball like this, a phone book, whatever works for you. Place it in between your knees and squeeze. When your arms are down by your sides, there's probably about a fist distance between your fingers and your heels. Maintaining that distance, maintaining a little arch in your low back, you will cinch your waist like you're tightening a corset or tightening a really wide seat belt. Squeeze the knees towards each other, push through your heels, and then from here, lift your pelvis up, keeping your spine stable. Up, up, up. You can reach your tailbone towards the ball, so you get a little bit of a traction of the spine. Push through the heels again. Simultaneously squeeze your glutes and your inner thighs. Cinch your waist. Inhale. Exhale. Inhale. Exhale. Inhale. Bend at the hips like a robot and land your sacrum down. Okay, this is a great starting place for the sacroiliac joint. So those are the two exercises for today. If you need more advanced involvement, please consult me and I can give you more advanced exercises to help stabilize that joint in a weight-bearing situation. Until then, thank you and bye-bye.